on Wednesday, June 18th, 2020. And we welcome you all to the COVID-19 community briefing for the week of June 15th, 2020. The following organizations are taking part in today's community briefing: SOVA Health of Martinsville, the Virginia Department of Health, the Harvest Foundation, the City of Martinsville, Henry County, and the Martinsville-Henry County Chamber of Commerce. As in previous weeks, we do ask that each speaker keep their updates brief, but while still getting the point across. And we also ask that all media do save their questions until the end. But to no further ado, we'll go ahead and get started. And if our SOVA Health representatives want to go ahead and provide us with their update, that would be great.
All right, good afternoon, everybody. Glad to be part of this team to be able to share with the community some information, update information. First of all, I want to start with making sure I always emphasize for all community members to please wear your masks, practice your social distancing. As we mentioned last week, other areas of the country and or the state are having declines. There are some spikes going on, I think, in some different states now, but we want to make sure that we're doing the mask. If everybody wears the mask, it helps. If one person does and one doesn't, it doesn't help necessarily. So if everybody could at least do that when you're out and about and in close proximity with folks and practice social distancing, would be much appreciated. It helps all of us feel better mentally, and it actually helps you to be safer when you're amongst friends and family. So also, Nancy mentioned, I think she'll talk about it this week probably. We had a pretty significant spike in the last 20 days prior to 7 days ago. The last 7 days we've had a drop. It's dropped down a little bit more than it was. So I had held off on the SOVA market is one hospital system of two hospitals. Danville had opened up their patient visitor week. I held off just because we had a spike in our county, in our city. Over the last 20 days, we have moved that forward. The latest data that I received from Nancy and the Department of Health showed that had kind of dropped back down a little bit. It's still higher than it was previous to 20 days ago. But what we're going to do on sometime early next week, we're probably going to open up our visitor policy at a limited basis. I want to make sure that I'm able to safely bring in a visitor per patient, if I can do it for my inpatients that are non-COVID patients, non-critical care. So it would be my med-surg, my telemetry monitoring patients, but my inpatients. So, part of the healing process is families getting together.
Dale, I think we're having some audio difficulties. We're unable to hear you.
I'm back.
Yes, you're back now.
Yes, something just popped up that said mute. I'm not sure how that happened, but so next week, sometime probably early next week, we'll announce that we're going to open it up for a visitor per inpatient in a couple of our units. And folks that are coming in, I just need to make sure they know you need to wear a mask when you come in, so bring a mask with you. We're not able to provide every visitor a mask, so we'd ask that you bring a mask with you. You'll be screened like everybody else is coming into the hospital for the standard questions to make sure we're good to go. And then we will have visiting hours in the morning and the afternoon for a 2-hour span, each of those areas, one in the morning, one in the afternoon. So at least that starts us back to some sense of normalcy for the inpatient side. So that'll be coming out the first of the week. Watch for that. It'll be posted on our website. And we'll get that out as much as we can to the media to make sure folks know that they're able to come in and visit with their family members and loved ones. So that's really a big change, from the past 2-3 months. I think that'll be beneficial to our community and to our patients as well. So we wanted to make sure we announce that. Just wanted to foot stomp again. We are opening that up, so it's safe to come to the hospital. I've mentioned this, and it's like a broken record. I'm not growing COVID in the basement, so it is a safe place to come to. We are taking every precaution to make sure you stay safe if you're a visitor, vendors, staff, and patients. So we've got a lot of measures in place to make sure folks are staying safe. So just want to make sure I reemphasize that. One last thing: survive, don't drive. Call 911 is a bullet I wanted to get out to make sure people hear. So I think that's everything I have, and I'll answer questions when we get to the end.
All right, thank you for providing those updates. It's always good to make sure the community is aware. Thank you. All right, next we'll go ahead and move on to Nancy with the Virginia Department of Health.
Well, hello everyone. We are delighted that the numbers are starting to go down. As of today, we have a total of 354 cases in the entire West Piedmont District. And during our sharp curve up, we were getting 20 to 25 new cases a day, and now we're seeing something more like 8. We continue to have issues with the Hispanic population. They're only 5% of our population, but they have more than 20% of the positive cases. So we're doing our best to get the word out to them. We've had some messages in Spanish going out, and we're currently recruiting 2 contact tracers that are bilingual, which should help a great deal. I'm sure someone else will tell you about the Mask Up MHC campaign that's going on now. I will say that the folks at the testing site are getting tired, and the lab charges are going up, making it very expensive. So I don't know how much longer we'll be able to rely on the folks at the test site. However, CVS Pharmacy in both Martinsville, Henry County, and Franklin County are offering COVID testing. So we will have a resource. Also, the Virginia Department of Health is having an open testing day, June 30 in Franklin County, which is for people who live in Franklin County. But if any of the employers have folks living in Franklin County that need a test, they can send it. It's free. It'll be from 10 a.m. until 2 p.m. at the Pig River Community Center on 220 Business in Rocky Mount. We have about 6 contact tracers in the queue to be hired, and we're getting a handle on it. Some of our concerns are that with school opening back, our nurses will have to be pulled back into their regular duties of immunizations and checkups for preschoolers, that sort of thing. And then the last thing I'll mention is our health departments are having farmers markets in the parking lots. One farmer with all of his goods every Monday in Franklin County and every Tuesday at 10 o'clock at the Martinsville Henry Health Department. So if you want to get fresh produce, but you don't want to get in a big crowd, the health department is a way you can do that.
Very good. Thank you for providing those updates, Nancy. All right, and next we will move on to Lisa Watkins with the Martinsville Henry County Chamber of Commerce.
Good afternoon, everyone, and thanks for joining us. Sorry, I was in a meeting with Leon, so we were running a little bit late, so thank you. Just really briefly, I know Leon is probably going to talk about the grants that the city has, but if anyone needs assistance with applying for that so that you make the most of your time, we'd be glad to assist you with that or any of the other opportunities for funding out there. We're happy to do that. And just a reminder, as businesses reopen, to please wear your mask and practice social distancing. We are going to join other community members with a Mask Up campaign, and India may touch on that as well. So thank you so much for being here.
Thank you, Lisa. All right, well, that will actually lead us into India with the Harvest Foundation.
Hello, and I apologize for joining a little late. Of course, technology decided to act up as soon as I logged on, so thank you. First, I'll touch a little bit on the Mask Up MHC. We have, one of our staff members has worked really hard and kind of came up with some of the ideas, hashtags, and you've probably seen the video that's been shared, just reminding the community to mask up. And so, it's a pleasure to partner with the chamber as well as other community leaders to really share that campaign to make sure that Martinsville County is masked up. And as Lisa said, you'll probably hear more information about that, coming up. Also, as far as what Harvest Foundation has been doing lately, I'm sure, you're aware of the Pay It Forward MHC forgivable loan fund that we have released, and we announced that on last Wednesday. And for those who aren't aware, this is a loan pool that we've put together. We've partnered with the Virginia 30-Day Fund to provide forgivable loans to Martinsville and Henry County small businesses. The foundation gifted $1 million in honor of our local healthcare workers and first responders, so that we can really make sure that we are supporting and providing that extra lifeline to local businesses in the area. It's a forgivable loan that is not required to be paid back, and it's really there to provide immediate financial assistance to meet payroll, healthcare coverage for employees, and also to save jobs, while a lot of these businesses are waiting for federal funding or until the economy begins to recover. This loan program is for employers with 3 to 30 employees that have been operating for at least 1 year and are based in Martinsville and Henry County, and that are able to provide a valid business license. To date, 51 businesses have been approved for the small business Pay It Forward MHC forgivable loan, and we are super, super excited about that. The turnaround has been really rapid with this, and that's one reason we decided to partner with the Virginia 30-Day Fund. They have the infrastructure to really, get the word out and make sure that and provide the oversight of a really uncomplicated application process and to make decisions pretty rapidly, which is really important to us because we didn't want small businesses to continue to go through long applications and challenges just to receive money. So we're really, really excited about that. Applications are still being accepted. To apply, you can visit the Harvest Foundation website, which is www.theharvestfoundation.org. When you go to our website, just hover over how to apply and then click on Pay It Forward MHC, and you will be sent directly to the application. The application is really a one-pager. It can be done on your phone. It's really simple, and you are required to upload a video, and it's really a simple video that you take with your phone, a selfie video, just saying, hey, this is my business, these are my employees, and this is how I plan to use the funds. So really simple, nothing too detailed. And then once that application video is complete, the turnaround is fairly quick, which we're excited about. So if you know of any small businesses in Martinsville, Henry County, the loans are up to $3,000. We really hope to get these businesses to apply. So thank you.
All right, thanks for providing those updates, India. Definitely a great resource for small businesses around here. All right, and speaking of small business support, we'll go on and head to Leon Tornicki with the City of Martinsville. Leon, would you like to provide us with an update?
Let me unmute. Here we go. Okay, sorry about that. Yeah, glad to talk a little bit about that. Thank you. The city and the county and other localities throughout Virginia are receiving funding, CARES relief for the coronavirus relief fund. The city is getting about 1.1 million. I think the county is getting a little over 4. We've decided with some of the funds that we're getting is to allocate that toward assisting small business in the city to, in some cases, if they've closed and they're trying to reopen, to help and assist businesses with expenses related to reopening. We have an internal committee that we've put together to review that. Out of that 1.1 million, at the moment we've allocated $250,000 towards small business grants. Worked on the application last week. We had it posted online this past, I think, Friday morning, maybe about Friday around noon. And as of today, we've already awarded probably between $35,000 and $40,000 worth of small business grants. There is an application process. If you go to the city's website, at the very top of the website, you'll see kind of in a bold red border something that says City of Martinsville's most recent COVID-19 statement. And if you simply click on that link, the very first paragraph of that, as you open that link of that text, you'll see a link to the application. You go right to that application. It's about a 2 or 3 page, just very brief application. We have an internal committee that we meet twice a week. We met this past Tuesday, and between Friday around noon and around noon Tuesday, we had received 13 applications. And I think of those 13, we awarded grants to, I believe, maybe 10. And there was 1 or 2 that weren't eligible, and there was a few that we needed additional information on. Today we met again. There was another 7 applications, so we went through that process again. And we will keep doing that until the applications dwindle or we run out of money or something. But the intent is to get this money in the hands of small businesses as quickly as we can. And the group, actually the group that we reviewed on Tuesday, those checks are out today. So those folks will get that money. They applied last Friday, Saturday, Sunday, Monday, and checks are out today. So they will get that money quickly. And that is the intent, is to get it in the hands of small businesses as quickly as we can. But pretty excited about the program. We're certainly encouraged by the number of applications that we're getting. Some are very good applications, very well written, very thought out very well. Some maybe not so, but we're reviewing all of them. And if there is any way we can work with an applicant to try to get funds to them that are needed, and it has to be COVID-19 related. We're getting some applications where people just want to use it to pay expenses related to vehicles and normal types of expenses. Typically those expenses are not eligible, but if it's somehow related to COVID-19 and issues that a particular business may have faced related to either reopening or that perhaps they were closed and they're now trying to reopen and they need assistance with protective equipment or sanitation equipment or anything like that, that's what these grants are for. So pretty excited about that. Applications are continuing to come in. We're going to review them twice a week, and then again, the intent is to get the money out as quickly as we can. So far, the response has been good, and we certainly hope that continues. I guess beyond that, things are, I'm not going to say getting back to normal here, but our building is back open to the public. We're limiting it to 50 visitors at a time, not counting the court side of the building. That number is not a problem for us because we typically don't have that many visitors in the building anyway. People coming into the building are wearing masks as they should. If we meet in group settings, there are masks. We're gradually getting sanitation stations up at various places in the building where there more public interaction than perhaps other places. Things are gradually creeping back to normal. I know this past weekend there was a youth baseball tournament at Southside, and my understanding there was about 18 teams that came here and played. There were some guidelines that were put in place to make that happen. There was some time allowed between games so that teams could leave the field before other people came on, so you didn't have everybody there at one time. Coaches are doing what they need to do to wipe down and spray down bats and equipment and things like that. So, folks are trying to comply with what's needed and trying to figure out a way to make things happen. Right now, as far as we know, we're still playing baseball with the Mustangs this summer. Certainly waiting to hear what some of the announcements from the governor's office are, but as of right now, that's still on with the potential start date of July 1. So things are gradually moving toward normalcy, whatever you want to consider that to be now. So we're certainly encouraged by that. And the information that Nancy shared with numbers going down, that's certainly, I think, certainly an encouraging sign for all of us. So thank you for that. So that's my piece. I'll be glad to answer any questions at some point.
All right. Thank you, Leon. Another great opportunity for small businesses. So thank you.
Absolutely. Thank you.
All right, and last but certainly not least, move on to Henry County. Dale, do you have any updates you would like to provide us on behalf of the county?
Hey, good afternoon, everyone. Yeah, I just want to make everyone aware of a few initiatives that Henry County is currently working on for our community to overcome financial challenges as a result of the pandemic. We plan to present these initiatives to our Board of Supervisors next Tuesday, and we'll hopefully be able to roll those out later next week. But some of the components that we're looking at will be some financial assistance for residents that may be having trouble paying their utility bills because of the pandemic. Another component will be similar to what the City of Martinsville is offering to their small businesses and what the Harvest Foundation is offering to small businesses in the form of grants. And we're tailoring those slightly different to capture some of the businesses that may not necessarily be available for the Harvest Foundation. So we hope to roll that out next week as well. And then another initiative that we're trying our best to work into the situation is to assist our volunteer fire departments and rescue squads during this time. As you know, many of those organizations depend on fundraising efforts to continue their operation, and because of the pandemic and the stay-at-home initiatives, they've had trouble doing those fundraisers. So we're looking to roll out some financial assistance to those organizations to help them during this time as well. And it's quite possibly that could be extended to other nonprofit organizations. And lastly, I want to just make our community aware of a free mask giveaway this Saturday. My Brother's Crossing and the House of Purpose Ministries will be distributing up to 2,000 reusable masks on Saturday. The drive-through event will be held at 232 Riverside Drive in Bassett. So if anyone needs a mask, this will be an easy way to get one. It'll start at 9 o'clock on Saturday morning, and they'll run until they've given them all away. So at 232 Riverside Drive in Bassett, that is the House of Purpose Ministry, and the masks are being provided by My Brother's Crossing Ministry. But I just encourage our community to continue practicing social distancing, wearing their masks when they're indoors in public facilities, and washing their hands. Thank you so much.
All right, thank you for those updates, Dale. All right, we will go ahead and move on to questions. We'll start with B99, Ron Morris. We'll go alphabetical from there.
Oh, but thank you. And thank you for having us again this week. Let's go with Nancy Bell first. We're having a slight drop in the cases there. Do you know what are the contributing elements to that? And what kind of stress is this putting on the Virginia Department of Health when they see people not exercising social distancing and wearing masks?
To your first question, I believe that our corporate partners have responded very well to the recommendations we've made, especially larger manufacturers have made some adjustments so that people can distance a little better. They've closed down and done some hygienic measures, done some on-site testing, enforcing mask wearing. I think that has a lot to do with the decrease in numbers, and I'm delighted to see it. I read today that wearing a mask can cut down your ability to spread or receive COVID by as much as 99%. So something so simple as a mask is, we harp and we harp, but it is the way to go. As to your other point, we have actually set up a page, and it's going to be on the West Piedmont Health District's social media page, but I can send it to any of you all who want it, where anybody can fill it out and complain about a business that does not enforce the mask wearing and etc. And it goes straight to VDH in Richmond, where they have more people to help deal with that than we do locally. And when you say tired, yes, we all are tired. Most of us haven't had a day off since the beginning of March. We still have things to do on Saturdays and Sundays. And if we could not do that if people weren't helping us, like this very town hall, to get the word out Our media partners have been awesome. Having the testing site and everything the Harvest Foundation has done. It's been incredible coming together, and I hope it lasts way beyond COVID.
All right, thank you. For Leon and Dale, do you have any idea if our area, with the spiking of COVID-19, if the governor would say tomorrow we can go into phase 3, would this area be prepared? For Leon or Dale?
I'll take a stab at that, Ron. You know, I would say that we are. We've been into this thing now for, golly, late March, so we're into it now for maybe the 3rd month or so. We've heard the updates, we've heard the information. I think we know where we are as a community with COVID-19. The testing processes are in place. We continue to hear from the hospitals that they have the capacity. I think we are, and I think people in the community would probably be anxious and welcome the opportunity to move to a phase 3. So, yeah, I think we would. I think we can do it.
Oh, also, I agree with Leon. I know we have seen an increase in cases, but just over the last few weeks, I've also seen our industries and businesses really stepping up to do a better job of making sure we're responding to the pandemic correctly. Our businesses are putting the measures in place to prevent the spread and keep their employees safe. So we're real proud of those businesses and industries that are doing that. And if they keep doing that, then phase 3 will not be too big of an issue for our community.
All right, thank you. That's all I have.
Thank you. All right, we'll move on to BTW. Luis, do you have any questions? Oh, we can't hear you, Luis. We may have to circle back around and get Luis in just a moment. We'll go ahead and move to the Martinsville Bulletin.
Can you hear me?
We can hear you.
Oh, wonderful. Okay. Good afternoon, everyone. Dale, Sova Health. I'm a patient at the hospital. My goodness.
We're gonna have to.
Am I back on?
Yeah, we can hear you.
Great. Let's give it another try.
Yeah, we're having technical difficulties over. Okay, you keep yours muted.
I'm muted.
Can you
Okay.
hear now? Talk.
Can you hear me?
Yes.
Okay.
Okay. Dale,
We have technical problems here too, so go ahead.
sure. The question, I'm a patient at the hospital. I was there this morning, and you go through the series of questions, and when you're approved, they give you a sticker that you put on your shirt, which then gives you permission to enter the hospital. And what occurs to me, I know you can't fake or lie your temperature when they check your temperature, but they go through the series of questions, the same thing that they do the courthouse, the city hall. What occurs to me is, you know, a person doesn't know if they have COVID. They can't answer those general questions. What measures do you take to make sure that people are truthful, and does it really serve a purpose? I mean, what are your thoughts on that?
We're doing lie detectors. No. So obviously, you know, there's an honor system to this. Absent knowing somebody's history, the temperature is a key thing that we use as a guide, you know, for a quick identification if there might be a problem. You know, there is no true 100% accurate way to do it from that perspective. You really have to kind of get a sense of what people are saying to you and understand how they're saying it. You know, absent folks not being honest, you really have to trust what people are telling you. That combined with the temperature component. There is no magic wand or way to really understand it. Now I will tell you, thankfully, folks seem to have been honest with us, and we have had folks that answer those questions in a way that has not allowed them to proceed, and they've complied. So I think folks want to be honest for the most part. I think people aren't out to deceive folks, and I would like to think that people have the best intentions when they're coming in. So I think it's working. Maybe there is somebody that could have slipped through, but it's working, I think, and I think it's borne out in the fact that we haven't had anything untoward happen, as a result of the folks that are come in and anything happen as a result of it negative.
Thank you. Nancy, you spoke to the Hispanic community as having an unusually high percentage of positive cases. And I read, I can't remember, I think it was one of the Roanoke television stations that had quoted you as saying that the numbers, at least in part, the spike in numbers was being attributed to breakouts in factories. Was that an accurate statement? Did you say that?
Yes, that is true. Factories and family gatherings were responsible for the spike. And if you think of it, if you're in a workplace with 600 people, there's not a whole lot you can do until you find that first positive person. So it gets away from you before you as a company can start doing anything. So I really think we did an excellent job of turning that around, because it could have been a lot worse.
Does it appear that the factory issue is beginning to level off now? Are you seeing any improvement in that, or is it still?
It's improving tremendously. And they have been very eager to have our assistance because work can't go on if all their employees are sick. So they've shut down, they've sanitized, they've put up plexiglass, they've reduced shifts by 50%. Everything they could do to keep the wheels of industry going, they have done. And we have advised them, unless there's something going on that we don't yet know about, we're very pleased.
Good. This is for Leon and for Dale Wagner. And last question. The federal relief money, COVID relief money that you guys are getting, the 1.1 from the city, 4, I think, in excess of 4 million for the county. I'm hearing questions about why the city, with the grant money they're giving, comes with a list of restrictions that it has to be used specifically for COVID purposes. And Dale, you're saying that the county is looking at using that very same money to allow people who can't pay their light bill to be able to pay their light bill. Can you explain the disparity there? It appears that the county is being allowed to use that money in a way that the city can't.
Bill, I'll take a stab at that. No, there's really not a disparity with that money, and I'm sure the county got the same information we did. There are a lot of restrictions attached to that. The money can be used to help individuals with utility payments. What we cannot do is, for example, here in the city, if we have a customer that doesn't pay their utility bill for COVID reasons, we can't simply take that money that we've got and go down to our treasurer's office and pay their utility bill for them. We cannot do that. You can't use it to supplement or replace lost revenue, whether it's from taxes or lost utility payments. What we can do, and I think what we are looking into, and I think Dale can talk about this, and I think that's what the county's doing, we can work through an agency like social services, like the Grace Network, and we're going to reach out to those and provide funding to those groups who can then administer those funds to individuals throughout the community who are affected with an inability to pay bills and utilities because of COVID-related purposes. And we intend to do that. We haven't gotten to that stage yet, but the money can be used indirectly in that manner to pay or to help individuals who can't make their utility bill payments. We just can't simply take the money and just go downstairs, and if we have 10 people that can't pay their electric bill, we just go down and pay it for them. We can't do it like that. At least our interpretation of those restrictions indicate that to be the case.
Yeah, that's correct. That's our interpretation as well, and that's one thing we're working on now is to come up with a creative way we can meet the intent of the CARES Act and use those monies appropriately, but still help out our residents as much as possible. And that's what Leon said. It's probably how that plan will be presented next week, either through the Department of Social Services or through a nonprofit organization that can help us with distributing those funds. I will say, as part of our money, is some of it's being used to cover overtime costs for our sheriff's deputies and public safety employees that may be helping with the test site. We've spent some of the money or plan, it's being appropriated, but we're spending the money on sanitizing equipment and personal protective equipment for our responders and making sure people who come to our public buildings, enter a clean, safe facility. So we talked about these programs coming forth with that money, but it doesn't take long to spend through money when you go buy and sanitizing equipment in a high demand market right now. Thank you. Anything else, Bill?
Leon, one quick follow-up. For the businesses that qualify and get money through the grant program, is there a component where they have to show proof that they spent the money the way that that it was intended?
Yes, it is. The way our process is working, there's an application, and in that application, our maximum grant is $5,000. In that, applicants have to present a budget of what they intend to spend that money on. And in some cases, we've had folks that have submitted just very vague applications. We want $5,000 and we want it for sanitation equipment. Well, we don't make awards like that. We need to see specifics. And we've had some applications that have come in and said, we're going to spend $873.22 on sanitizer stations and $923 on gloves and that kind of thing. And with that kind of information, we will process that and make an award. But at the end of the day, we'll write the check. And then the follow-up is that at the end of the process, somebody on our committee is going to go back out to that business. And we do have a verification process that the money that we've given those individuals has been spent on what they indicated they were going to spend it on in their application. So there is receipts that are needed. There will be a verification process just to be sure that we kind of close the loop on this thing to make sure that the money is being spent for what the businesses are telling us that they intend to spend it on.
Good. Thank you.
Hey, Bill, a quick follow-up to your question. We do, and this really reemphasizes the masking component. As I said before, I think folks are being fairly honest with the questions, a series of 5 or 6 different questions as you've gone through when you came in. But in addition to the temperature check, we are requiring everybody to have a mask on when they're in the facility. So all our staff do, all patients do when they're coming through the facility. So that's an extra precaution. If somebody were not being totally honest, at least we have some level of protection with the mask-to-mask combination that we're doing in the hospital as well. So just a quick follow-up for you. Thanks.
Thank you.
All right. Next, we'll go back up to BTW 21.
Hello, can everyone hear me now?
We can hear you.
Awesome. Good afternoon to everyone. My first question is for Dale. Just to emphasize again, when you guys reopen to visitors, you guys will still be doing the temperature checks and requiring the mask for the protection of the patient and the nurses, correct?
It's absolutely correct. And the visitors will be required to have a mask on as well.
Thank
and
you.
what we're going to do is have one visitor per patient. We're going to have 2 segments of visitation hours, one in the morning and one in the early evening. And then we're going to just manage that and track that as folks come in and visit their loved ones. Yes.
Thank you. Next question for Nancy Bell. We've heard from government officials that they say that they believe we're ready for phase 3. What is your take on that?
I'm tending to lean towards it now. If you'd asked me last week, I would have put the brakes on. But I hope when the time comes that the municipalities will avail themselves of our data to make an informed decision.
And can you touch on and emphasize what kind of measures are going to be taken for the Hispanic population? I know the biggest concern with the Hispanic population is they believe that they're going to be asked legal questions, which is not true.
Right. We want to get people who are positive better, and we want to prevent people that they're interacting with from catching the COVID virus. So we are only about getting you identified, getting your close contacts identified, and making recommendations as to testing and treatment and the types of severe symptoms that would send you to the hospital. They should still avail themselves of those.
And my last question, again, to you, Nancy. The biggest thing that we hear from the community whenever we talk about COVID-19 is that they're bored of hearing about it, or they want to move on. Do you feel like people are letting their guard down?
I absolutely do. You know, one of the reasons I wear my mask is to remind me to wash my hands. It's a pain in the butt, it's omnipresent. And I come back from a meeting and it reminds me to go ahead before I take my mask off in my office to go ahead and wash my hands. So, you know, have some fun with it. You can do some artwork. I think the Harvest is having a mask contest. It's such a simple thing, and it's such a great tool that we don't care how sick they get of hearing it. That's the message. Wear the mask.
Thank you all.
Thank you. All right, Charles Ward with Sardays.
I understand the press conference I had, and one of the things that was kind of left out was that we understood that the spike that y'all were having the press conference over was because 75% of the spike was Hispanic, but that really didn't come out. Is that accurate?
I don't know the percentage, Charles, I'm sorry, but yes, it was among, you remember at the press conference when we said it was businesses and it was families, not social distancing. Yes, I think that was mostly Hispanic, that outbreak.
Right. Does that make it a sensitive issue because it's one race? Is that something that makes it sensitive?
Yes, I think it does because some ethnicities, I can't say the word, some groups are more social and have larger family units, and dad comes home from work and, you know, everybody gets sick, grandma and everyone else. You know, we have worked with United Way. I think this has been a matter of not being able to afford to isolate. So we're working with United Way when folks need to quarantine to actually, we're paying for some rooms at the Dutch Inn so we can get families isolated away from someone who's sick. And then there's a ministry that's bringing food over. So that was the problem. It wasn't necessarily, I think it's lack of financial resources. So right. Now we have sort of a no excuse thing that if you need to isolate, we can put your family in a motel. The motel doesn't necessarily want the sick person coming there to isolate, right. But they'll make accommodations for the family, and then the church will bring over the meals so the family can truly be isolated.
That's good to know. My next question goes to Dale. Will the program be similar to the $5,000 program for the businesses? Is that what you're kind of tailoring it to? Will that be the limit? And and then I have another question for Leon.
Charles, it will be a program similar to the City of Martinsville's program. The exact dollar amount and the eligibility requirements has not been determined at this time.
I got you. Now let me ask Leon. The fact that not as many people are walking through businesses' doors, isn't that a factor of COVID? I mean, could that be a reason for funding?
Probably not under the grant program that we have. What we're trying to do more is if businesses need to reopen and they have, certain physical things they want to do inside, barriers, plexiglass panels, sanitation stations, we even going as far as automatic flush valves and restrooms and things like that. Those kinds of things are what we're gearing it to. We are getting some applications from individuals who, and particularly, barbershops, hair salons, beauty situations, those kinds of things where they actually had to shut down. So there is a period of lost revenue. And now as they try to regroup and they're having back payments on bills and things to cover, we're looking at some of those things, and where we can help out, we do.
All right. How about utilities and payroll?
Some of it depends on whether they've already applied for and received PPE money. If they haven't and they're applying, if we can help them, we do.
Right. Next question for Lisa. The programs can we go over every program there is? I know that you got PPP and things like that. Is the chamber offering any grants? Can you just go over the quick programs? Obviously, we've got city and county now. We've got to harvest. Is there any more?
Sure. We actually still have some money for uptown businesses through our facade grant. It's a matching grant up to $4,000. And we just recently closed our application process for CPEG small businesses. You do have to be a member of the chamber and can apply for or could have applied for some upgrades to your facility or other needs that you have in your business. And we'll be announcing those pretty soon after our CPEG board meets. In addition to that, we still are assisting folks with a grant through LISC, and I can't remember what the acronym stands for. That's one of the resources that is listed on our chamber website. And so that is a grant program to Virginia businesses. Those are very competitive. I really commend the Harvest Foundation for doing the Virginia 30-day program, just because they've set aside that money specifically for businesses in Martinsville, Henry County. And that's one of the ones that we directed, one of the opportunities we directed people to several weeks ago. So we're grateful that there is money set aside just for our businesses here. And that helps with being able to assist folks locally through those programs when there are set-asides for that. And as well, the city and the county, I commend them as well for their leadership in doing that. And again, if anyone needs help with accessing any of those programs, Kimberly and I and Sharon, we're very glad to help businesses do that. Like Leon and Dale both said, there are specific things that you can utilize the grants for. And so we want to make the most of your time. And if we can help you with getting your applications in a manner that they're easily approved, that would make the most of your time. And then you can focus your time on your business versus trying to muddle through which application is the right one for particular needs, because you might have several needs. So those are just things that I hope will be helpful to business owners out there.
Thank you, Lisa. I'm done.
Thank you.
Thank you. All right, we will move on to WSET. Are there any questions from you all?
Hi, good afternoon. So I do have two questions. The first is for Sova. Excuse me, I have a lot of notes in front. Forgive me. The new visitor policy that's coming into play. Is this going to be part of a phase program, or is this just a touch and go kind of thing?
So it is a phase program for us internally in that we're going to go with 2 inpatient units initially with 1 visitor, and then as that goes well, probably a week later we'll look at ramping it up a little more, maybe adding another visitor and or adding another department another area. So it's an internal phase for us. As far as the county phasing goes, or the state phasing goes, we're ready and can manage to any level, frankly, all the way to 3. So we're capable and have what we need on hand. We're still ready for fluxes if we end up having something like that or something that flares up. But the phasing for us is internal in that we're trying to go slow and be safe, but make sure we continue to progress with opening up to visitors.
Okay. And I'm not sure if you would be able to help with this or not. Is Danville following the same thing, or are the two entities looking at one another during this process?
Absolutely. So what Danville did this week, they took the measure that I'm taking next week. They did that this week. I held off a week because of the spike that we had last 2 weeks. I decided to hold off to make sure that was an anomaly and it wasn't something that was going to hit us hard, which it did not. So that's why I decided to move forward this coming week. And then Danville, we're going to try to align and have that on the same phasing schedule as we go moving forward. And I think we should be able to do that starting probably the following week. So yes, we are working together and collaborating on that.
Okay, and so we're looking timeline for this to start really next week.
Correct.
Alrighty, thank you very much. And then I believe your name is Lisa with the chamber. I'm not sure. I apologize if I get it wrong. This is not my normal beat. Is that who I'm speaking with?
Oh,
Lisa?
yes. I'm sorry. Yes, thank you.
Yes. Okay. Yep, that's the right person. I had to wait for the picture to pop up. So is there like a central place that business owners can go, whether a website or a database, that will have a listing of several of these grants and loans available?
Yes, actually, the Harvest Foundation has been kind enough to create a separate site. India, if you'll help me out, resilienceMHC.org.
ResilienceMHC.com.
Thank you. Thank you.
Can you spell that for me? My spelling is terrible.
Sure. ResilienceMHC, and it is .org. I'm sorry, .org.
Thank you, India.
Thank you.
They've been kind enough, as we provide information from the chamber, to update that so that everyone could go to that one site and take advantage of any of the opportunities that are fit for them. So thanks.
Outstanding. That's all the questions I have. Thank you.
All right. If those are all the questions for today, then this will conclude today's briefing. We would like to thank each of our guests today, and as well as the local media for participating. And we look forward to seeing y'all next time. We hope everyone stays healthy and well.
Hey, thanks. Have a good one.
Thank you.
Good afternoon.
Thank you.
All right, folks, that does it here for our